coming up on NC Impact. The number of people with Alzheimer's and other forms of dementia is rapidly growing. We'll take a look at what's being done to improve care and support caregivers. This is NC Impact.
NC Impact is a PBS North Carolina production in association with the University of North Carolina School of Government. Funding for NC Impact is made possible by
changing the course of people's lives. That's the impact UNC Health and the UNC School of Medicine work to deliver every day. Our 40,000 team members across the state of North Carolina are committed to caring for you, our patients and communities, as well as educating the next generation of healthcare professionals. Individually, we can do a little, but collectively, we can do a lot to create impact.
Welcome to NC Impact. I'm Anita Brown Graham. Alzheimer's disease is a brain disorder that slowly destroys memory and thinking skills. It is a common cause of dementia, and it eventually impacts the ability to carry out the simplest of tasks. In North Carolina, 180,000 people aged 65 and older are living with Alzheimer's. That number is expected to rise to more than 210,000 by 2025. NC Impact's Evan Howell visits a man who now lives with the disease in its early stages, and Evan shows us how this man's life has changed.
Yeah.
You sure?
Jay Reinstein has worked in city government for nearly 30 years. He still remembers the day when he couldn't answer a citizen's question.
And it was that point I went into my office and I wouldn't say had a little bit of a breakdown. I was afraid because I thought, first of all, I'm not going to be able to do my job anymore. I know he didn't hear. He says, okay, that's great.
He talked to his wife and got in touch with a neurologist at the Duke Memory Center. And it was there where he received the diagnosis no one wants: early stage Alzheimer's disease.
What really made me think is, what's going to happen in my life? What about my daughters, my grandkids, my job, financials? I mean, how am I going to support my family?
Since Reinstein retired in 2018, his daughter Elizabeth has taken on a supporting role at home when his wife is at work. She joined him on trips while he was on the board of the National Alzheimer's Association, helping him navigate the frustrations of travel.
I always spent a lot of time with my dad before, but now I try and spend as much time as I can with him. We've been going on trips.
She knows there are no answers for how quickly the disease will advance. She says that's why it's important to cherish the time right now.
I try and take as many pictures and videos as I can, just for good memories. And I just try to look at the silver lining of it all.
His daughter and wife help him look after his medication. He prefers short articles over books and says he needs to binge watch a TV series so he can remember.
The thing that worries me the most is I don't, want to be a burden. And I know that that day will come.
It's moving.
He says until then he will continue to fight against the stigma of Alzheimer's and not have the disease become who he is.
I'm not going to be that guy when I'm hanging out with friends always talking about my disease. I want to talk about, the Washington Commanders, which there's nothing good to talk about there.
Reinstein says he's now living a joyful life with the disease, and that all he wants to do is make the time he has count. For NC Impact, I'm Evan Howell.
Dinner.
Joining me now is Mark Hensley. Mark is the Associate State Director of the AARP North Carolina chapter. Mark, this work is personal for you. What was it like for your parents? And talk to us a little bit about the challenges you faced as a caregiver.
So, Anita, my parents were older when they had me, so I became a caregiver in my mid-30s. And for my parents, it was that awareness that they were losing their independence. Unfortunately, cognitive impairment generally starts affecting your ability to manage numbers. My mother could not balance her checkbook. She was missing paying bills, she was making financial mistakes, and I had to step in and start helping her with that. And that was the first time she realized that she was losing her independence.
I mentioned earlier that the number of people living with Alzheimer's in North Carolina is rising. This trend has been called the coming Alzheimer's crisis. Can you help us understand what is causing the trend?
Well, I can. First of all, every 60 seconds someone is diagnosed with some form of dementia. Alzheimer's, this is the most common. Every 60 seconds someone receives a diagnosis, every 8 seconds around the world. The most common prevalence is aging. So a woman who's 85 or older has a 50-50 chance of getting some form of dementia. So as we are now living longer than we ever have, living to be 100 or more, the older you are, the more likely you could become susceptible to some form of dementia like Alzheimer's.
And so in a state like North Carolina, where we're experiencing an aging population, that means a greater percentage of people who live here will be struggling with this disease. Is that right?
That is correct. I've been watching this for close to 30 years. We used to be the 9th fastest growing state of people 60 and older. This year we changed to the 8th fastest growing state. And that number is going to continue as we know people are moving here from other more populous areas, from the north, because we have a beautiful climate, we have a great cost of living, and North Carolina is a great place to not only live but to retire.
So it's obviously a challenging situation for the individual and for that person's family. How are communities impacted by this rising population of those living with Alzheimer's and other forms of dementia?
I say that this is the everybody issue. Everybody you talk to has a story. An aunt, my grandmother, my parents, my neighbor. This is so prevalent that communities are impacted. For example, you go to a restaurant, we have special menus for children, special seating, but we don't have those accommodations for older people, especially those with cognitive impairment. They need a seat in a restaurant that they can push up on. They need their food in separate bowls so they don't get confused. Those are just small changes that a restaurant can make, but also places of worship where we gather. Shopping can be impacted because 3 out of 4 people in the community that have some kind of cognitive impairment are living alone. They're trying to navigate buying groceries. They're trying to drive in a car. And as the disease progresses, at some point it's going to impact their independence, and it does have a big impact on the community, trying to count money, trying to make purchases, and trying to drive.
Thank you, Mark. We'll come back to you. Stick with us. It's estimated that 1 in 4 hospital beds are occupied by people living with dementia. NC Impact's Sloan Heffernan joins us with a pilot program that trains healthcare workers on how to approach patients with dementia.
The Dementia Friendly Hospital Initiative is aimed at reducing hospital stays and improving outcomes for patients with dementia. While the program is relatively new, healthcare workers here in our state tell us they are already seeing positive results.
It'll make you worry, won't it?
Caring for patients is Kim Gillimet's job at UNC Wayne Healthcare in Goldsboro.
I reckon cousins.
She says one of the most important lessons she learned in nursing school was to make sure the patient is alert and oriented.
It's important that they know what's going on. It's important that they know where they are so that they can interact as part of the process.
But a new initiative designed to make hospitals more dementia-friendly goes against that training.
Well, we really didn't have a true approach in the past. You know, we took care of patients. If they seemed confused, we tried to determine how safe they were, but we really didn't have the knowledge and the education of how to approach them.
Are you gonna help me out?
UNC Wayne Healthcare is one of several hospitals in North Carolina participating in the Dementia Friendly Hospital Initiative.
Because working with dementia is very difficult.
It's a UNC pilot program that trains healthcare workers how to approach a patient with dementia, and more importantly, to meet patients where they're at through role-playing exercises. Anyone who comes into contact with a patient, from housekeeping to security, receives this training.
Now I might approach someone who thinks we're at their house, and I might say, well, you have a beautiful home. It's just important to be agreeable and okay and accept them wherever they are.
For every 1,000 people in North Carolina with dementia, there are an estimated 1,600 emergency room visits. Experts say patients with dementia are admitted more often and end up in the hospital longer.
It's costly for the patient family, for the healthcare system, and for the patient themselves.
The hospital also installed purple lights to signify a patient with dementia. And the hospital created these dementia busy boxes to help preoccupy patients as they receive care. The Dementia Friendly Hospital Initiative requires extra time in an already stretched hospital system. But the healthcare workers at UNC Wayne Healthcare say it's been worth it.
We look at the reward. We look at the reward of having people stay less in the hospital, less complication, less cost, and less life lost. So that's our reward of taking time and having enough staff to do this job.
You're doing real good.
A new way of nursing that is paying off with the growing number of patients being treated with dementia.
What do you think?
UNC's Center for Aging and Health received a 3-year Duke Endowment grant for $720,000 to fund the program.
Thank you so much, Sloan. Joining me now is Heather Hooper. Heather is the Executive Director of the Dementia Alliance of North Carolina. Heather, thanks for being with us.
Thanks for having me.
We saw in that story a very patient-centered approach. What role can training like that play for someone with dementia?
Absolutely. Being in the hospital is already overwhelming. It's, stressful and finding your way around. So having a dementia on top of that, someone may have problems or issues communicating pain levels, communicating how they are understanding their treatment. And so this clear and concise communication can really make a more productive treatment environment for those living with dementia and the healthcare workers, as it just showed in the video.
So give us some more good news, because Mark talked about the rising number of cases in North Carolina. What other initiatives across the state are showing progress as it relates to caring with those who have dementia?
Absolutely. So on top of the UNCs and the Outer Banks having dementia-friendly hospitals, we're seeing an increase in support groups, in memory cafes, and also the North Carolina BOLD initiative. So it's taking that public health messaging of brain health and putting it into all the different facets of public health that we hear on a day-to-day basis. So I'm really excited about that BOLD initiative of bringing more attention to brain health.
So it sounds as though there are lots of great things bubbling up, and I'm sure there are viewers who are wondering, what ways can our community come together and collaborate with healthcare systems and facilities and others in order to continue improving care?
Yeah, absolutely. So, encouraging your community or even organizing education and town hall meetings, asking about crisis intervention training for our first responders. That is, the first step. These are the first people seeing people that are in distress and living with dementia. And so we want to make sure that those people are also trained. That's an easy training that Dementia Alliance does for many counties. Additionally, I think increasing supportive services for caregivers and hopefully encouraging more healthcare providers and geriatricians and educating them on how to diagnose early so we can get these supportive services in early.
Thank you.
Thank you.
That's terrific. Hospitals aren't the only organizations working to better serve the dementia population. NC Impact's David Hurst joins us with a program in Orange County that is training businesses and other organizations.
Anita, it's called the Dementia Friendly Business Program. The goal is to create a network of businesses and organizations that understand how to best communicate with individuals who have dementia. The training and education are not only helping those with dementia, but also their caregivers.
Elizabeth Hirsch specializes in helping older adults move.
It's a very intimate service that we provide. We're going through people's belongings. We're going through their entire history.
She's the owner of Downsizers, a Chapel Hill-based move management business. She says downsizing can be especially helpful for those with dementia.
Because the less you have to take care of, the less you have to remember, the less stressful it is.
She and her team have certain policies when they're helping move individuals with dementia. A lot of what they've implemented is thanks to Orange County's dementia-friendly business program.
It allowed us to really think about how we want to specialize in it, and that's actually enabled us to build an entire internal training program and protocol because of that program.
Run by the Orange County Department on Aging, the program provides training to local businesses and organizations on how to best communicate and interact with people who have dementia.
We think it's played a vital role in, particularly with our folks that are caregivers, that are out in the community with folks that have cognitive issues. And it just makes them feel more at ease when they go to a restaurant or they go to their bank.
I took her to Jersey Mike's for lunch.
More than 100 Orange County businesses and organizations have received this training since the program launched in 2015.
Just making sure the businesses know that, hey, everybody else or a lot of other folks in community are working on this too, to try to bring our community forward and become a little bit more dementia capable together.
Meals on Wheels Orange County is another organization that's been through the training. It's helped their volunteers not only interact with individuals who have dementia, but also teaches them how to recognize the early signs.
People volunteer because they want to help their community. They get engaged with us, they pick a route, and they get to know the people on their route. And then they see the other issues that are affecting older adults, and they want to be able to do something to help beyond just the delivery of the meal.
As for Elizabeth Hirsch, she says change can be difficult for anyone, but particularly for those with dementia. She's thankful to have the framework to help make a big transition like this a little bit easier.
When they're walking into their new space, if we are replicating as much as possible, their comfort level is higher, their stress level is way lower, and they are feeling more confident in their new space.
The Orange County Department of Aging also serves as a one-stop shop for aging services in the county. With over 100 community partners involved in this work, community leaders say collaboration has been the difference maker.
David, thank you for that story. Let's bring back our experts. Joining us now for the NC Impact Roundtable is Madison Buchanan. Madison is a program manager for the Eastern North Carolina chapter of the Alzheimer's Association. Madison, let's start with you. Why is it so important for businesses and other organizations to seek out this kind of training on how to interact with individuals with dementia?
Yeah, absolutely. And thank you for having me. So it is really important, right? And so first of all, I think a big piece of this is it's going to be improving the quality of customer service for these businesses. Their employees and their workforce are going to be able to truly understand and respond to these dementia-related behaviors they're seeing in their customers. And so in turn, that's going to show the community that this business is supportive to those extra needs that these customers are having. But it's also showing that to caregivers. And what's important there is that's also going to impact their employees. And so we know that 6 out of 10 caregivers are employed, and about 57% of those last year were either coming in late, they were leaving early, or they were taking time off specifically because of those caregiver demands. And a lot of those are also in the sandwich generation, and so these are folks who are caring for an aging parent while also caring for that dependent living at home. And so when you look at this, full picture, this little bit of extra dementia training that these businesses can do is going to help across the board with their customers and their employees and really their presence in the community as a whole.
I love that. Know a little something about the sandwich generation for sure. Mark, let's circle back to our conversation about caregivers. We've heard that many of them are employed. They've got other challenges they're dealing with. Talk to us a little bit about the kind of financial and emotional stresses these families are facing.
AARP recently did a survey across the country and found out that on average, caregivers are spending out of their pocket around $7,200. And that's $7,200 that's not reimbursed through any insurance or any other program. So the financial burden is real. For myself, my mother, in a moment of confusion, she dropped her Part B Medicare. And that meant that she had no prescription drug coverage, that we had to fill that gap. Also, transportation is a big need, and just daily care, things that are not covered if you're still living in the community, because as you have needs and as those increase, you've got to find a way to pay for it.
Yeah. Heather, these kinds of costs can be devastating. And of course, this show is all about communities coming together, working together to respond to challenges. So let's go back to this topic of what communities can do to better support caregivers themselves.
You know, I really think making the community more age and dementia friendly is a great start, and there's so many great initiatives in local communities across the state. Additionally, advocating for better support services, for advocating your state level for better FMLA laws across North Carolina, just more support services, more funding, so that we are, finding caregivers in the beginning before it's a state of emergency. Often at our office, we are finding caregivers when it's an emergency. And so, educating them and becoming educated more as a community can help everybody to really just improve the lives of those living with dementia and their caregivers.
Absolutely. So Madison, let's pick up on that for a minute. Your organization's most recent Facts and Figures report highlights a significant shortage in the dementia care workforce. What needs to be done from a workforce development point of view to create more of these caretakers and, as Heather has said, earlier in the process?
Yeah, absolutely. So, just an example, we know right now there's about 158 geriatricians for the entire state of North Carolina. And so when we look at this growing population...
Wait, can you just repeat that number? Because that seems staggeringly low.
Right? 158. That's it. Yeah. And so we know this population's growing, right? These folks over 65. And so to be able to keep up and just stay at that number, we're looking at a need for about 238% growth. That's a big jump, right? So that's going to take a lot of pieces. That's just geriatricians. There's a lot of other healthcare workers and need in this area that we're going to need to increase those roles for. And so one solution is looking at really expanding the roles of different types of providers. And so think your physician assistants, your nurse practitioners, even your non-clinical office staff, looking at what roles they're doing and maybe starting to add in coordinating care services into those positions. And so now you're looking at the ability to take caregivers and families directly to services that they need, outside of those day-to-day appointments. And so an example of that is our Direct Connect program we have through the Alzheimer's Association, where a provider can take a patient and their families and directly send them to the Alzheimer's Association, connecting them with those community services and those resources that they need. And that can be before or after a diagnosis, when those questions are starting to arise. And so when you build in something like that from the beginning, you're going to start to see, a big impact for those families. And that sort of gives us the time to really work on building out that workforce. But, we've also got an entire pillar of our organization that's focused on problems like this by working with our healthcare systems. And so it's a big problem, and it's going to take a lot of different solutions working together for sure.
I wonder, Mark, whether you want to weigh in on this issue of caregivers. We started the program highlighting this wonderful young woman who is spending a lot of time offering care to her dad. But everybody doesn't have that. And even when you do, it doesn't mean that you don't need professionals to support you. So this feels like a really big problem for our state. What are you thinking?
So the direct care workforce issue is one of our biggest problems, because a person with dementia is different than other diseases. If you have dementia, your judgment, your thought process, your logic is all affected. And as Heather said, you may not be able to communicate that you're in pain. You may not be able to manage your medications or bathe or dress yourself or think about the complexity of cooking a meal. All of those are tasks that someone has to do. Falling on an unpaid caregiver, we have staggering in the billions the amount of care provided by unpaid caregivers, that if we had to provide that with paid staff, we simply don't have the resources. And that is why direct care to provide respite care, and for those that don't know, Respite care is temporary or intermittent relief from your caregiving to come in and bathe mom or dad, to cook a meal and feed them, or just stay with them so they're safe, to allow that caregiver to go shopping, get their hair done, or just take a break.
Yeah, it's complicated, and there are a lot of people implicated in this pipeline of care. Mark, Heather, Madison, I can't thank you enough for joining us and for sharing the important work that you're doing in the state. We want you to tell us what your community is doing or how we can help you. You can email us at ncimpact@unc.edu or send a message on Twitter or Facebook. And be sure to join us every Friday night at 7:30 on PBS North Carolina for new episodes of NC Impact. Coming up on NC Impact, staffing shortages remain a problem for many schools across our state. See how some school districts are getting creative in recruiting and retaining teachers.
NC Impact is a PBS North Carolina production in association with the University of North Carolina School of Government. Funding for NC Impact is made possible by
changing the course of people's lives. That's the impact UNC Health and the UNC School of Medicine work to deliver every day. Our 40,000 team members across the state of North Carolina are committed to caring for you, our patients and communities, as well as educating the next generation of healthcare professionals. Individually, we can do a little, but collectively, we can do a lot to create impact.